Well, good morning. We're here this morning with elected officials and appointed officials from the county and the city of Richmond, the counties in the city of Richmond. I'm Pat O'Bannon. I'm chairman of the Henrico County Board of Supervisors. So thank you for joining us today. We're here to discuss the conference that's coming up, Revive RVA, as you can see up there. Early last year, Henrico County recognized a need to have comprehensive and coordinated responses to this crisis. The crisis, of course, has been well documented about heroin and opioid addiction. We've been raising awareness this past spring. We had summits at our high schools. I attended one summit. There were many parents there. Some brought their children. Some were just the parent, some were just the children. And it was an excellent way to build awareness with the families in the community and those who are at the forefront of it in their high schools. We are focusing on prevention, and that's why you see us here today. Henrico's Heroin Task Force worked with the high school students. First, I want to mention their website, which is bouncebackhc.com. And it provides information and resources about the heroin and opioid epidemic and abuses. And it's Henrico's first responders who now give away refrigerator magnets with that bouncebackhc.com logo to families when they've treated someone with a heroin overdose. Now, we've been helping with recovery in Henrico. We started a pilot program in drug court, and volunteer participants receive treatments with Vivitrol, which controls opioid cravings. And we're providing Revive training to the public. And those are classes that are designed for friends and families of someone who is at risk of overdosing. And at the same time, by the way, that's the class that's going to be provided at the Revive RVA Summit. And at this time, we have other folks who want to speak also, because this is obviously a group effort, a regional effort, because this is not in one community, it's in all communities. And it's something that we feel very strongly about in your communities. So next, I think Chesterfield is good. I'm going to turn it over to you.
Thanks a lot, Mr. O'Bannon. I think this is another example of how our region bands together on the important issues. Somebody actually made the remark yesterday at the Junior Achievement ribbon cutting. Somehow we get together for 47 out of 50 ventures, but only the 3 that we don't get together seem to make it to the headlines. And you know, heroin and opioid abuse, they really have no boundaries. I mean, we've certainly seen that. And so we, as a region, we're coming together to share our experiences and our expertise to conquer this problem. I know that our public safety departments actually have been working together on this for several years now, but we all know that it's much bigger than just public safety. In Chesterfield, we've really taken a hands-on approach, all hands-on-deck approach. We have prevention, education outreach, treatment, public safety, harm reductions. We have 12 different departments involved, and we have received several grants. This is a multifaceted problem with no simple solutions. I mean, I think everybody realizes that. If it was simple, we would have fixed it by now. So we in Chesterfield, we are really committed to working with our partners in the region to turn this crisis around. So at this time, I'd like to turn it over to Angela.
Thank you, Dorothy. I'm Angela Kelly Wiesek. I'm chairman of the Hanover Board of Supervisors, and virtually every meeting I go to these days, I meet somebody new, and largely I'll meet somebody who has lost someone to the opioid and heroin addiction crisis. And their stories are all different, but sadly they all almost always have the same heartbreaking end. And so we are committed as a region to learning from and working with all of our state and regional partners to save lives. So in Hanover, we too have had a number of drug forums, and our most recent event was attended by over 600 individuals. But quoting from our sheriff, David Hines, who will be one of our panelists at the Revive RVA Summit, what we need now are more than words, we need action. So here are some of the measures we've taken in Hanover in terms of prevention, life-saving response, treatment, and recovery. So as education is key, our Hanover Cares Coalition has used grant money to assist Teens Care 2 youth group in creating a program called Hidden in Plain Sight. So this is a free community initiative designed to help educate parents on the possible signs of drug and alcohol use by their teens and strategies for identifying how teens may try to disguise the problems that they're having. Also, our health department has distributed over 1,200 drug deactivation kits in our community because we know that unused prescription medications pose a significant risk to people who are looking for drugs. In terms of our life-saving response, our first responders carry antidote treatments to attempt to revive overdose victims. And again, the Hanover Health Department has made this available to be dispensed at no charge to citizens who are at risk. Our Community Services Board is the front door for services for those with substance abuse problems. But sadly, this year we're expecting the number of substance abuse clients to almost double from 5 years ago. The Pamunkey Regional Jail is offering peer-based substance abuse recovery programs through a private partnership. And plus, we've launched an adult treatment court pilot program similar to the juvenile drug court that we have offered for years. So these programs attempt to break the vicious cycle of drug use and interaction and incarcerations, and we have experienced very meaningful success in that regard. But again, we must do more. I'm committed to ensuring that this summit results in actionable steps that make a difference. However, we'll need everybody committed and on board, and that's the message I want to deliver here today. And I hope you as members of the press will help us get that message out, because this just isn't about first responders and human services staff. We need parents, we need our state legislators, we need healthcare professionals, we need friends and neighbors, we need everybody on board. It will not be easy, but it is essential if we are to stem the tide of this epidemic and systemic loss. And now I'd like to invite Mayor Stoney to speak on behalf of our partners in the city of Richmond. Thank you.
Thank you, Angela. I think we all are here because we are not only trying to draw attention to an ongoing crisis, but because we believe we must actively engage in seeking the solution. The solution to a scourge of opiate and heroin abuse that haunts all of us in our localities. Heroin and opioids do not discriminate. They have no respect for city limits or county boundaries. They do not spare the young or the old. They do not care if you live in public housing or in a mansion on the river. They're not one person's problem or one neighborhood's problem. They're all of our problems here in the Richmond region. They are a problem for all of us, and we must attack this terror together using all of our resources in every one of our localities. Here in Richmond, our police department is a partner with the Virginia Department of Health Opioids Prevention Task Force. We partner with the Virginia Recovery Project to help connect people seeking treatment with the help they need, providing referrals for those who have overdosed. Our Richmond City Health District has been allocating naloxone distribution free of charge as it revives trainings and post-clinical counseling. Everyone in Richmond and the surrounding counties is working hard to attack this epidemic. Yet I know that year-to-date in Richmond, we've had 35 fatal overdoses from opioids this year. That's 2 fewer than we had this time last year, but we've had more non-fatal overdoses this year, 300 compared to 245 last year to date. Ladies and gentlemen, getting better at preventing more people from dying is a good thing, but it's not the solution we seek. Like Pat said earlier, we want the upcoming Revive RVA Summit to provide more than training and education, but to focus on the solutions. Steps we should be taking together in terms of resources and taking advantage of and making a difference for all of our residents. And because this summit is free and open to the public, there's no excuse for folks out there to not get involved in the solution. And so, we invite you all, but also we want you to get the message out about our event on October 26th to learn more about the problem and being a part of the solution together as a region.